Here's something wild. Herbs that improve blood circulation in Chinese medicine can directly shut off the molecular switch that makes cancer cells crave sugar. A lot of late-stage cancer patients deal with this sharp stabbing pain that gets brutally worse at night. And if you look under their tongue, you'll often see two veins that are dark purple, swollen, and twisted like cords. In TCM, that's called blood stasis, blocking the channels. And modern science has found that this exact problem is the hidden driver behind a tumor's obsession with sugar. Let's break it down at the cellular level. As tumors grow, they trigger rapid formation of new blood vessels, but these vessels are badly constructed. Twisted, leaky, prone to blockage. Some areas even have blood flowing backward or not flowing at all. The result, the tumor's internal environment becomes severely oxygen deprived and prone to clotting. In TCM terms, this is textbook blood stasis. Clinically, patients show a dark, dull complexion, dry, scaly skin, and that telltale dark, swollen vein pattern under the tongue. Here's the critical part. Modern science discovered that this oxygen deprivation activates a molecular switch inside cancer cells called HIF-1 alpha. Once that switch flips on, the cancer cell abandons efficient oxygen-based metabolism and switches entirely to aerobic glycolysis, a much less efficient process. Because it's suffocating, it has to hijack glucose from the bloodstream at 100 times the normal rate just to survive. Now here's where it gets clinically interesting. When blood-activating herbs like leech extract, zedori, safflower, or curcumin are introduced, modern pharmacology confirms they significantly reduce blood viscosity and improve microcirculation around the tumor. In plain English, they pump oxygen back into the area. Once oxygen is restored, that hypoxia switch HIF-1 alpha gets forced off. And without that switch driving the process, the tumor's frantic glucose consumption drops dramatically. On top of that, lab research has identified specific compounds that act as direct molecular brakes. An extract from Paris polyphylla, for example, has been shown to precisely block the glucose transporter GLUT1 and hexokinase on the surface of cancer cells, essentially cutting their dedicated power line. So across this whole series, in both Chinese and Western medicine, sugar itself isn't the villain. The real key is telling good carbs from bad sugar. Cut the refined stuff completely. Sugary drinks, milk tea, processed pastries, these spike blood sugar violently and drive chronic inflammation. Lean into whole grains, brown rice and vegetables. These support healthy digestion and release glucose slowly and steadily. The best cancer strategy combines Western medical treatment with TCM's approach: strengthen digestion to restore proper nutrient flow and improve circulation to clear blocked pathways. Take care of your gut and make sure every bit of nutrition you eat becomes fuel for your immune system, not for the tumor. That wraps up this series. Like, save, and share it with someone who needs it. See you next time.